should EPO be legalised in elite level cycling? It's gained a lot of attention of late in the widespread sort of media with cases such as Lance Armstrong having his 7 Tour de France wins removed or stripped from him for taking EPO throughout his career. So there's a lot of literature to cover on this topic, so we looked at a few articles. We'll obviously review them and summarise at the end. But we're going to go over 3 main points today. So firstly, what is EPO? Secondly, why would an elite cyclist use EPO? And thirdly, why shouldn't an elite cyclist use EPO? Okay, so firstly, what is EPO? Well, EPO is an abbreviation for the term erythropoietin, which is a hormone that's produced in the kidneys, which stimulates red blood cell production through the bone marrow. It's been studied for quite a long time, but sort of in the last 30 years it's been quite a bit more popular. It's naturally higher in people that live at high altitude, or athletes who are constantly sort of exposed to environments with low oxygen. The muscle tissue sends signals to the kidneys to produce more EPO. So as we can see here, the first sort of studies were done around about 1905 by Professor Paul Carnot. His French lid and that assistant whose name I'm not even going to try and pronounce. And they initially did studies on rabbits. They subjected them to bloodletting and found that there was a hormone that helped them produce more red blood cells even though they were being stripped of their blood. Studies were done further and further after that, and in the 70s the big breakthrough studies came when Adamson and Eschbach proved its effectiveness in treating anemia. In the 80s it was then produced in synthetic form, and by 1989 was approved by the FDA for use in treating anemia patients. And by 1990, so they were onto it pretty quickly, there were already the first reports of use in elite cycling. So more about sort of anemia and why it's used. So anemia is obviously a lack of healthy red blood cells in the blood. So as we can see here, it's generally a case of people suffer from anemia if they're low in iron, or for those that have renal failure or on chemotherapy or have unfortunately contracted AIDS. And Epogen, which is the biggest, most widely used EPO drug, according to their website, they've had 1.4 million prescriptions since 1989 till 2010. So it's obviously quite widely used. So the first study we looked at was a 2000 study, as you can see here, published in Pediatric Hematology and Oncology, called Recombinant Human Erythropoietin Beta: The Effect of Weekly Dosing on Anemia, Quality of Life and Long-Term Outcomes in Pediatric Cancer Patients, by Dermaz, Demirkio and Sevnier. The big quote from the article is that it says, "We determined that the use of EPO beta in lymphoma and solid tumour patients with a once-weekly regimen was effective in increasing hemoglobin levels, decreasing transfusion rates and improving quality of life." One big part to take out here, it says this treatment regimen was safe, did not cause serious side effects, and thus can be recommended because of its higher patient compliance and tolerability compared to previously investigated methods. No effect of EPO on prognosis was evident. Then it says the low number of patients and the early loss of advanced stage patients may explain the lack of effect, and this situation could be clarified by using larger patient groups. There are obviously problems with this study that they've kind of explained themselves, as we can see here. Firstly, there were only 2 groups consisting of 16 members each. So as mentioned before, according to the Epogen website, and it's not the only drug out there, with 1.4 million people being prescribed the drug in 21 years, 2 groups, meaning 32 people all up being tested, is obviously a ridiculously small sample size of the potential people that have been using the drug. The study was done on only 12 weeks of EPO use. The good thing about the study is that they followed up years after the initial EPO use was administered, so they looked at a few of the long-term effects. However, it was only on 12 weeks of use, so a lot of patients with suffering from renal failure and anemia and so forth will be taking EPO for a lot longer than 12 weeks. The study was obviously not done for athletes, but athletes taking EPO will be using that for a lot longer than 12 weeks as well. Now, another big quote in there was also that patients who did not receive EPO treatment and or chemotherapy regularly, for whom the chemotherapy regimen changed, who died very early, who had gastrointestinal system bleeding, or who experienced side effects due to EPO, were excluded from the study. So big problems there. Obviously, ethically, it's going to be unethical to keep administering EPO to those who do experience side effects, but removing them from the study doesn't really give you an accurate representation of the effects of EPO, because they're saying, obviously, in the slide before, no effect there, but the sample group is small and people who had problems with it were taken out of it. So it's a little bit biased, obviously. Things that they could do probably in future would be, try and work on a bigger group, because that will give us a more accurate representation. Obviously, you can't administer EPO to people who experience terrible side effects, but if you included more of the effects that they have in the study, it's going to give a more accurate representation of the effects of EPO. And also potentially a study on longer term use of EPO. Had a video here with side effects, but obviously we can't look at that, so we'll just pretend that we watched that.
And I looked into why cyclists use it, what their perceived benefits are, and the theory is that it increases hematocrit, which is the red blood cell percentage in the body, and that in turn increases oxygen uptake in the body and endurance. So the more red blood cells in the body, the more oxygen can be transferred to the muscles. As Liam explained, that it's used for people that lack red blood cells in the body, but cyclists initially have a higher red blood cell percentage in the body than you or I, because they're well trained. They are endurance athletes anyway, so their natural red blood cell percentage will be higher. So increasing it even more would, of course, put them at risk. It also aids in recovery for the Tour de France, which is the biggest cycling race in the world. It's 21 days of back-to-back riding, 170 k's a day. So obviously, recovery is a big part of cycling, and the EPO helps that. Is it proven to help athletes? Well, Cons 2003 showed an improvement in all the aspects I just explained. But what they did the study on was endurance-trained athletes, not elite or world-class. So for you or I, it would probably increase, but for athletes, elite athletes, we're not so sure. This is the study, or many studies, and it's got what substance they were injected with, EPO, placebo, and iron. And over here, the little squares are the original VO2 max tests, and the triangles are afterwards. So as you can see, in each EPO example, the VO2 max improved over the time. But down here, the first line is the trained athletes. The second line is well trained. The third line is elite athletes, and the last one is world class. And no athletes started at world class, so they didn't test any world class athletes, just trained athletes, which did show improvement in all those aspects. Also, sort of looked at the ethical side of why cyclists use it, and the desire to win at all costs. The Tour de France is the biggest cycling event in the world, and lots of teams have high paid sponsors that want the team to win, do well, so they're trying not to let them down. And also team members, young and inexperienced team members, might feel influenced by, say, Lance Armstrong, who has been accused of pressuring younger and more inexperienced team members to use EPO. If he comes up to you and says, "You've got to do this to win," then you probably listen to him. So I had that video there that was from a former team member that explained the pressure that he sort of put the team under to use it. So that was the ethical side of it, and this is why not to use it.
Right. So I'm going to use some notes because I've got the memory of a goldfish, but basically the perceived benefits of EPO are probably believed to be largely outweighed by also the proven side effects of the EPO. So some of them were heart disease, stroke, cerebral pulmonary embolism, and the autoimmune disease. So basically what happens with the heart disease, such as blood clots, thrombosis, strokes, heart attacks, are all from an increase in blood viscosity, so the thickness of the blood, due to the increased amount of red blood cells produced from the EPO. So basically the strokes and your heart attacks are all caused by clotting in the veins, blood can't get to the brain, obviously causing a bit of a dysfunction up there. So With the autoimmune disease too, large amounts of EPO being injected into the system, then your body basically forgets how to then produce it itself. So you're basically going backwards with the EPO use, and your red blood cell count will actually drop off after you've discontinued your use of EPO. Healthy individuals could develop, could compromise their renal system as well, so they could become anemic. In clinical use, constant monitoring basically occurs to ensure the patient's full recovery and avoid such side effects. However, in long distance events where the body's being pushed to the absolute limit, constant monitoring isn't done. They're very vulnerable to the side effects. They're much more susceptible to the effects of due to the dehydration, increased heart rate because of their sport, often upwards of 110% of their max heart rate will really push the boundaries of that EPO. So the blood thickening from non-medical use of EPO may be further exaggerated by that dehydration and the increased heart rate. Normal levels of EPO in the body usually range from 4 to 24 milliliter per milliunits per milliliter of blood. In the EPO use, however, cyclists accused of blood doping and EPO use have seen levels of 45 to 60 milliunits per. So obviously that's a pretty big increase in the EPO and probably a dead giveaway that they've been blood doping. Again, these extreme levels are greatly increased by the chances of disease and adverse effects on the cyclist. Finally, we also went into, is it fair, more the ethical use. I had a video there with Mark Cavendish talking about, a cheat's a cheat just at the end of the day. Did I get that name wrong? No, Cavendish? Yeah, basically saying a cheat's a cheat. You have cheats in every kind of level of everything, education, cheating on tests, stealing, but yeah, again, can't really see that video. And as I was saying before, 14 of the 25 most recent winners have either tested positive or have confessed to using doping. Together with those tested positives but never sanctioned, there's 68% of the winners have evidently used doping. Finally, in reviewing the literature, we discovered that studies were performed on patients suffering renal failure or sub-elite athletes, which is a far cry from the elite athletes that actually participate in the Tour de France. The results of the studies were very conflicting. Some showed positive influence, the other one didn't really show much increase at all in the VO2 max with the EPO. The others spoke of the side effects, while others chose to ignore the side effects and actually block them out of their studies to make the EPO look like it was safe. Further studies need to be done on the athletes using EPO to get a better understanding of the effects of high-level EPO usage. However, EPO being banned substance provides us with the ethical limitations to perform such studies on elite athletes. Finally, given the potential side effects, whether the EPO is beneficial or not to performance, we believe that EPO should probably remain as a banned substance for the time being until we all have a better understanding. That's about it.
Any questions?